is okay. We can do that. All right, we're getting ready to start.
Okay.
I'm checking, of course, our Facebook and YouTube to make sure it's all connecting. So, how's the weather where you are?
Weather here, it was raining, drenching this morning.
Really?
The sun came out this afternoon, but it's, of
Uh-huh.
course, it's near sunset, so I will only have it for a few more hours.
Okay. And
It
and
was unseasonably warm. It was 73 today. Uh,
see, yeah, it was 80 here.
yeah.
Yeah, Raleigh, Carolina is like probably 80, 85. You can feel the humidity. So, but it's just typical North Carolina weather.
Yeah, 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 yeah. Well, let's see. I think we're live. We have someone else coming in.
I don't know.
Well, it says parchment. I don't know what that is. So we're gonna wait a couple seconds.
Parchment, was it like they parch for
I
drink?
have no idea.
Yeah, fine.
I
We have to
do not know.
do
But
a toast.
we'll say it
We
again.
have to do a toast.
Oh, absolutely, absolutely. So we're live, we're up, and we're ready to go.
All right.
Isn't this exciting?
It's very
All
exciting.
right, so let me do my introduction. I want to make sure that I introduce Dr. Rowland properly today. So, because last time we just jumped right in and I didn't introduce you properly and I felt bad and I had to go back to my podcast and introduce you properly. And I don't want to do that today. So I want to make sure I read some of, a little bit of your bio and some of my thoughts about the fantabulous Dr. Rowland.
Mhm.
Um, so, to my Bar Talks family, welcome to part two of our conversation with Dr. Lane Rowland as we're talking about COVID-19 and all things, COVID-19 and how it affects the minority communities, and just having a candid, casual conversation with a medical professional that is accessible, and he has tons of education, and he does not mind sharing the information with people all over the globe. So, Dr. Lane Rowland, like for the past couple months, I've been watching him just skate all around the globe, as I say, during this pandemic. And, sometimes I'm looking at him like, how is he doing it? But it's because he's informed. It's because he knows what's going on. He knows what he's doing, and he's spreading information throughout to keep all of us safe. He's certified chemical and biological warfare expert who is dedicated to saving lives and eradicating the coronavirus. He's making an urgent call to change, by speaking truth to power about this disease and how it's affecting our communities. His mission, as I read somewhere, it is driven by the passion to change today's COVID-19 statistics to create a brighter tomorrow. Dr. Lane Rowland, welcome back to Bar Talks, the podcast.
Thank you very much, Queen Love and Dr. Jones. We have to do this right because see, I've done my job for I've talked to the country of Ireland. I've
Mhm.
talked to the state of North Carolina. I've talked to the American Bar Association. Now is an evening time, so we can relax. So I salute you guys with my glass of wine.
I
Salute,
as well. Salute.
salute, Dr. Jones, and boy, and just have a great evening with some great new friends of mine that I have a great deal of respect for. Salute.
Absolutely. Absolutely. Thank you again. Salute. Now, we also have Dr. Patricia Jones Blessman. Dr. Patricia, I do not have your bio in front of me, but would you mind sharing a little bit about yourself with those that are tuning in with us tonight?
Okay. Thank you, Lane. I'm actually a clinical psychologist and the with a lot of experience around trauma and working with clients through traumatic experiences. This pandemic has been an eye opener and earth shattering for a lot of people in the psychological field. There's very little literature around pandemics and the experience of pandemics and what it does and how it impacts people.
Mhm.
This is just as much a psychological crisis as it is a medical crisis. I've had 30 plus years of experience in the field, licensed clinical psychologist, and actually came out of retirement to actually continue to do more work with Lane. Actually, I met Lane back in March, and it was such a fortunate for me to have met him. He's such a great teacher.
Yeah.
I said, even though I have a PhD and license and all that, I had to go back to school because I know nothing about
Yeah.
very little about pandemics and how it wreaks havoc on people's lives and the lives of the community. So so that's sort of my background. 30 years of experience, been in private practice. I've taught school. I've been taught at the graduate school level. I've had a wide, varied experience. Now, in my latter years, I had a just before I retired, the last 10, 15 years or so, I had a private practice, concierge practice, where I worked with high net worth, high profile, high achieving clients who were going through some kind of vicissitude in life and needed to very discreetly work through whatever those issues were, but still keep their A game because they either ran companies or divisions or whatever. Um, so I've had a very good life and a very good experience, and one of the things that I appreciate about this part of my journey now is that I get to give back to the community, and I've hooked up with someone who has been very generous in the way that he has shared his knowledge, and through him I get to broaden and expand that to other people, and particularly people in our community, so that we can save lives.
That is awesome. Well, again, salute and thank you so much for stopping by the podcast.
Thank you for having me. Thank you, Dr.
Thank you. All right. So this is part 2. First time you were here, Dr. Rowland, you dropped some bombs on us, and you had people talking and wanting to know more and buying up products from SRS and just doing all types of things. Anything to keep us safe, right? I also shared that I lost my father right before our last recording, and so there was a lot going on, and you are now blessing us again with your presence. So I want to get down to the nitty gritty of what you've been doing this last month. Um, First of all, before I go into the Q&A, and also I want to share really quick because, sometimes we have people coming into the studio. We have Belinda Curry coming into the studio. Does anyone know who that is? Is it okay for me to let her in, or tell me what you want me to do?
She's on my Facebook. Curry, yeah, you can let her in. She's
okay.
Okay.
Okay, I will add her to the stream. Welcome, Miss Curry. You are live on Facebook and on YouTube, just so you know. And welcome to Bar Talks, the podcast. We have already started, but thank you for joining us.
Okay.
So you may want to adjust your camera a bit. And Dr. Rowland, please go ahead and catch us all up with what you've been doing this last month since we saw you last.
I think you probably know you know where I'm at all the time, so I don't want to. I'm very humble, but I've been blessed. I've been in New York, I've been in Jacksonville, Florida. I've been on MSNBC. I've been on the Black Channel. I've been very blessed in talking to countries like Ireland and stuff, and Trinidad, Tobago about the COVID healthcare. Pandemic, but it's not a pandemic anymore, it's an epidemic. So I've been blessed to have the opportunity to get out there and get my voice heard, and also the opportunity to help some patients that have actually gone through the COVID-19 health crisis themselves.
Mm-hmm.
But the recovery part is unbelievable. One of the things I want Dr. Jones to be on this call today, because today I got to talk to the country of Ireland once I got off the airplane here in Raleigh, North Carolina, and I was talking to mental health nurses and stuff, talking about the impact of the pandemic on people's mental attitudes and how do people move forward in the future, because this is our new norm. So I've been pretty busy, and I'll let you, Queenie, this is your show. I got my wine, so my brain is calm. I'm with the flow, and I let you guys dictate. I'm in the back of the bus.
Yeah. So you said that you are in Raleigh right now.
Right.
Now, and you arrived there today. I mean, you have truly been spreading the information about COVID. I have watched you through all over YouTube and IG, showing as you land, the things that you're doing. Of course, I saw you on the big news channel, and I'm like, oh my God, that's Dr. Roland. And he stops by Bar Talks. I'm so honored. But more so, I'm just excited that you are getting out there, you're putting the information out there because people need to not just hear you, but see you out there talking about this virus, because that's not what we've seen in the past. And so it's nice to finally see someone that looks like me that's given information that is useful for people in my community. And I believe many of us will probably accept it better coming from a person like yourself.
Well, Queenie, Dr. Jones kind of been at the beginning. I think Miss Curry's kind of followed me on Facebook because she's always responding and stuff. And it's great to have people that are just normal folks like Miss Curry that they understand my message. And one of the things that when I got put on the congressional caucus for the COVID healthcare task force, one of the reasons they came and got me was because I look like them.
Yeah.
And I told the guys, when they sent me this letter talking about Dr. Roland, we want you to be on a COVID healthcare task force, I told them I'm a nobody. Why you want me? And they say, Dr. Roland, man, we saw the work you did in the jungles of Peru. 1% of the people certified in chemical biological warfare. You got 6 degrees. My God, where you been? And I said, I've been in the jungles doing push-ups to save people's lives, and this is my moment in time. And Dr. Jones will tell you, she vetted my butt. I didn't even know what the word vet means. That at first I was offended by it, but I'm not offended by it anymore because I did get nominated 3 weeks ago, Global Humanitarian of the Year.
Yes, I love that. Yes, congratulations on that nominee.
I'll be able to do a lot because the award is $500,000, and they give out every year since 1933. And I'm the first Black brown chocolate that's ever been nominated.
Wow. That's,
Dr.
you
Jones,
know what? Wow. That's like
That's
a whole
awesome.
different conversation when you think about it. Like when you put that into context, it's like, wow, so congratulations.
Congratulations. Yeah.
So what you go ahead and add that while I sip on this wine.
Go ahead. So we want to get into our Q&A. I ask for, I don't know who's clicking on, something's clicking over there, but anyway, I ask for some of the viewers to send in some questions so that we could jump right in and get your opinion, your answers, the information that you have to share for us. So I want to start kind of with my own personal questions first, and then I'm going to get down to theirs, okay? So, it's said that African Americans are disproportionately affected by COVID-19. Why greater exposure to viral infection? Like, why is that? Why is there a greater exposure for us for viral infections?
Well, first I'm going to talk about the actual viral exposure, and then I'm going to let Dr. Jones talk about the mental exposure.
Okay.
The first part of it is that we don't understand the significance of what this virus has done to our society, period. You people got misinformation in the beginning. It's a hoax. Drink Clorox, etc. And what happens is the politicians got into my profession, my lane of infectious diseases. Period. I've never seen these guys in the biological warfare laboratories in Fort Detrick, Maryland. I got a top secret clearance. I'm a military guy. I've never seen none of these guys in Germany in my BSL-4 laboratory. I definitely haven't seen any of these individuals that are running their mouths off in the jungles of Peru, going down the Amazon jungle, hiking the jungle for 9 hours, dealing with snakes and piranhas and mosquitoes and spiders bigger than your backpack to get to a village to save people's lives. And so this is where we're at today, is this misinformation. So a lot of black folks already had a mistrust in the healthcare system anyway. We've
Yeah.
talked about this. Keep it real. They
Yeah.
were injecting black people with syphilis in 1932 to 1972, watching people's babies come out with missing eyeballs and brains, and they could have treated them.
Mhm.
Black people have always been in the healthcare disparities, been in the back of the bus. That's
Right.
reality. Under the Medical College of Georgia, they found over 10,000 black bodies
Wow.
under the College of Georgia. They were dissecting black people in science and anatomy. Do you understand that if you are a black baby and that black baby is treated by a white doctor, this is fact, your baby has a 3 times more chance of dying.
Mhm.
Wow, that's
Yeah.
scary. So you
Yeah.
can what they would do to an older person, 35, 40, 56. If your life ain't no value as a baby, you know your life ain't no value as an adult.
Right.
That's why I come in to bring the education, the information. Like Dr. Jones said, I'm a free black man, period.
Yeah.
And I'm too old to change. Like Big Mama said, when
Mhm.
you get my age, and I was born in 1908, I'm gonna tell it like it is.
Yeah. And
Miss
that's why we love you. Dr. Jones, would you like to add to that?
Yeah, I would. I think there's a number of reasons why everything that Dr. Rowland said, I just want to add on to that.
Sure.
Black people tend to be disproportionately part of the essential worker group,
Mhm.
which means that their exposure to the virus, they're going to be more exposed to the virus. We're less likely to have jobs where we can work from home,
Wow.
less likely to, we more likely to have jobs that require us to take public transportation, which in and of itself puts us out in the public and in a much more riskier setting.
Right.
Um, Black people, African American people typically may not have insurance coverage or may not have substantive insurance coverage. So the rate of, just being insured in and of itself and
Mhm.
having good insurance coverage in and of itself is important. Um, and then being able to feel comfortable enough to pay all of the co-pays and whatever else is going to go along with that. Typically, just even before COVID, it was less likely that Black people would get premium or gold standard care for any condition that they may be faced with. The only the only medical treatment that Black people get more of than any other race is amputations.
Mm.
Other people, their limbs get saved, but Black people, the first thing they think about is chopping it off. So
Right.
now you think about in the age of COVID, what's happening to people who might have a COVID diagnosis. I think in an earlier show, Dr. Lane Rowland mentioned, well, if you get a COVID diagnosis and you feel like, you need to go to the hospital, go into the hospital and make them treat you, because
Mhm.
that's what's going to save you at the end of the day.
Right.
And a lot of time, and what we've been hearing from patients is they go and they tell them to go home.
Yeah.
Literally, if they're not like on death's door, they tell them to go home. But we know
Yeah.
that the people who get better are those who get early treatment, and the earlier you get treatment, the better your outcome will be. Um,
Mm.
in terms of
Hold
our
on, hold on, hold
medical,
on, hold on. Let's pause for a second. I want you to repeat that because I think that's huge. That if
yes,
you have these symptoms, the earlier you get treated, the earlier the probability of you being
right.
okay, like being able to fight this.
Because one of the things that, like, if you look at breathing, being able to, people can be walking around and not be getting enough oxygen and not realize that they're not getting enough oxygen. But even when they
Wow.
realize it, they can go to the hospital, and if they're not on death's door, I mean, we've heard reports of people saying, well, they just told me to go home, and then, or they told my daughter or my child, they told me to take my child home, and then the child later died.
And
um,
that's happened times.
and that is happening a lot. Now
Yeah.
if you think about
That is.
some of the high profile cases that we've seen,
Mhm.
Can I ask a
where
question,
we've
Miss?
had two, go
Really
ahead.
love the show. I love the show because every time I have a different drink and stuff. And I think next time we do a whiskey, Miss Curry, do you want to say anything to the top? What have you learned from Dr. Rowland?
Dr.
Because you
Dr. Roland, that may be your microphone. Hold on one second. It may be your microphone. I don't know how you're mic'd up, but there's a little clicking going on. But I want to make sure that we heard all of that.
Queenie, you go ahead and ask the question to Miss Curry, and I'm going to mic my phone because I think it's important because she's the people that we're representing.
Okay.
These are folks like your dad that we
Yeah.
have to keep alive. So I want you and her to have a conversation, and what she's learned from
Okay.
me and you and from Dr. Jones.
Okay, that's fine. So, hi, Miss Curry. How are you? Welcome again to the show. Maybe you can you are muted, so let me help you get okay, so now you're unmuted. Perfect. So why don't you share a little bit about what you've learned in your experience during this pandemic or endemic that we're currently in?
Okay, thank you. I'm sorry I was late. I was working from home and I took a nap and then I got up and saw that I had a message about this event. So I'm glad to be
That's
here.
okay.
I, I've learned a lot. I'm a minister by training as well. And I used
Mhm.
to, in my other life, I used to work on church denomination policy. So I was first African American to work in that position. So I'm very interested in getting accurate information and hearing from somebody who's uh, up to speed and know about the subject and can share with us as African Americans and people of color so we will know what time it is. Because some of my friends are not taking this serious. You know what I'm saying?
Yes, ma'am. Yes.
And like the doctor said, both doctors, if we get a cold, that usually turn into pneumonia.
Mm.
So I have learned a lot by listening in. I've learned about the 5 F's and the R's and things that we should be doing and things that we take for granted to know how to keep us safe. And what I do, I pass on the information to folks because I keep saying to them, we need to take this serious because we do not want to end up in body bags.
Absolutely.
So I've learned about the ways it can be contracted because like when he talks about the salt shaker. So that was interesting to learn how you can just pass that
Mm.
object and then that virus is on there and then you are exposing other folks.
Mhm.
But I've learned, I've ordered some of his products that, about, you never think about, turning down the commode lid, and
Mhm.
things like that.
Mhm.
You don't usually be thinking about that. But this is a different season that we're in, and we really need to be paying attention to what the scientists are saying and
Right.
not what some other folks are saying. So I've worked with professors and folks from all walks of life and have worked overseas myself, and so I know I can tell when somebody's giving you information that is accurate.
Mhm.
Things that are productive for our lives, and that's why I like to follow him. I've learned so much, and I've been passing on the information, the videos to folks that said we really need to be taking this serious, and like as he talked about what we were going to be experiencing in through October and November. And when you see what's going on in the context now, we really are where he said
Yes,
we are. We
ma'am.
really are in the second wave. And I saw him on MSNBC. I love MSNBC. And I told some of my other friends, and I know they saw him as well. So I
Yeah,
think it's good. We all have different gifts. I think it's good that we have a brother with his gifts and talents trying to educate us.
absolutely.
So we don't want to be Tuskegee, and I'm not taking no shot.
Yes, ma'am.
If the scientists said take the shot, I would take it. And even
Mhm.
like this year, I did not do the flu shot because he explained about the different strands. There's so many strands and how this virus can take on more strands. And so you can't say, well, we got this here, this that's going to help these people. If you haven't dealt with all the strands, how can you really deal with the
Yeah.
virus? So I took the pneumonia 23 shot, like he said,
Mhm.
and I
love,
was questioned when I
love,
went
love it, love it.
okay, all
Love
right.
it. Okay, Queenie, let's get going, girl. Because
Yeah,
hey, I all
so
right.
Miss Curry. Okay, I got you. I got you. Miss Curry said she took the Nomovax. Is that Nomovax 23? Is that right? Okay, we talked
Yes.
about it on our last podcast. So I'm glad to know that we have someone that took it, and here she is today. All right. So, and you did mention that, buying the products, and the product website came up on the screen. So for those that are watching, make sure you jot down this website and definitely go out there and get some of the products. We'll talk about it a little later so you know exactly which products we're talking about. Okay, all right. So since we were talking around the room, and it seems consistent that we're speaking about the importance of literacy, right? I personally said that we needed to have more or higher health literacy within our community. So I ask you, and I kind of heard it, but how important is this for us as, community of color to have a higher awareness of health literacy within our community?
We have to take responsibility for our own health care. We have to take responsibility for our own community. The government's not going to do it. And the bottom line, that as Black African Americans in America, we don't trust the healthcare system. Dr. Jones is absolutely right. I'm a master surgeon. I went to Harvard 30 years ago and I took the master surgeon course. I amputated a lot of people's legs off in my career, thousands of them. And I was one of the only Black surgeons there, and I got this famous panel at Harvard. And I asked a question to the panel that was on the stage: why do Black people get their legs cut off more? Is it because you guys don't understand the culture? And the doctor said they do not understand the culture. It's easier for them to cut somebody's Black person leg off than to try to save that leg and spend a year seeing this patient every week, maybe twice a week. So we have to have people that look like me, Dr. Jones, to be able to relate like you guys. People think that I'm, when people look at me, one of the things I've always done with my personality, who I am, I'm a human being. I'm mortal. I get diarrhea, I'm drinking a glass of wine, I get sick. But at the end of the day, I'm a human being, but I've been granted with God's gifts, with the knowledge and the ability based off of real life experience. I got 6 degrees. So you take 6 degrees, who got more degrees than I do on the planet? And then you put in real application. Phil, I think I'm a pretty bad individual. I'm not bragging because I want to be humble,
Right.
but God gave me this ability to be able to carry people's crosses.
Mm-hmm.
And I've carried enough babies' crosses. I heard enough mothers scream and cry when their baby died and wish they could go back to yesterday, an hour ago, a week ago. So I understand that. And so we have to have people that talk our lingo, relate to us. So when I'm talking about grits, most people understand grits. Most people understand there's a difference between collard greens and spinach.
Yeah.
I don't like spinach. I like collard greens. There's a difference between a Betty Crockett pound cake than a pound cake that my grandmother made, weighs 9 pounds. And that's all I want to say on that one.
Yeah, there is definitely a difference. All right, so I want to go to the questions really quick that we have coming from YouTube. Brown Girlism, I'm sorry, says, I know you do not advocate to take the flu vaccine, and why? But why are all the doctors pushing people to get the flu vaccine?
Because they're probably getting paid. There's some type of incentive that. If I base my information, when I walk into a room, I promise you, I know more in that room than anybody on science and medicine. That's just a fact. You're not going to raise your hand in my lecture, not unless you got 6 degrees, and you better bring it on. You better bring your A game, because I'm not into dealing with hoax. So the reason why I say about the flu shot, folks, you go to CDC, 25% effective, maybe 10% effective. If I had a 75% grade in school, would you want somebody operating on your mama, your daddy, your child that has a 25% average? I don't think so. And the fact that if you understand the genetics, we're talking about genetic virology, that the influenza virus is an RNA virus. The shot they give you today does not have to deal with the shot of what the virus is today, because that profile of that virus is 3 years ago. That virus mutates, antigenic shift, antigenic drift. Same thing with the SARS-CoV virus. This virus mutates every 2 weeks. The word I want everybody out there in the world to write this down, because I love teaching people. The word is called affinity maturation. Let me repeat it again. Affinity maturation, which means that when you get exposed to a disease, virus, bacteria, your body sees it, remembers it, and makes antibodies to fight that infection when you get exposed again. Well, guess what, folks? There is no affinity maturation with the SARS-CoV virus.
Wow.
So I tell you, you can get it 1 time, you can get it 2 times, you can get it 3 times. That's why people get the flu shot and they get the flu.
Mm-hmm.
They get sick. And there are people that get the flu shot and still get the flu. So that's the basics behind it, based off of science and medicine. If you understand the science, you have to know the medicine. The medicine, you definitely got to know the science behind it.
Okay. All right. We're going to go. I hope that answers your question. We're going to go to a Facebook question. And it is, how is, I wasn't ready to go here, but I'm going to go here. Okay. How is it that Trump and his team with COVID-19 recovered so quickly? I wasn't going to go there, but I'm going to go there now.
Hey, I was on the Black News Channel last week. I was waiting for MSNBC to, because that was one of the questions they sent to me to be ready to answer on this live show. Right. Let me tell you why the Trump is doing so well. And I mentioned that. I mentioned that on the Black News Channel because Trump is taking corticosteroids. He's taking the steroids, prednisone, hydrocortisone. If you have a fever and I give you a hydrocortisone, you're not going to have any fever. In fact, you're years old, but still infectious. The virus is still inside you. The only they've done is they suppress his immune system, but the virus is still in his body. If you go in front of Trump's face right now, he coughs in your face, I promise you, you'll probably be in a body bag in about 14 days.
Wow. Wow. Okay. So I hope that answers your question, Emiko. That's like, okay. That's that. So that's the Facebook. We're going to go back to YouTube. Someone asked, what is the treatment? And yeah, someone just asked, what's the treatment?
Folks, because I'm a professor of pathogenic virology, I know material. You get into the literature, you can get any medical book, go to coronavirus, go to the SARS-CoV virus. You know what it says in that book? There is no treatment. There is no treatment for coronavirus. Wow. That's in the written literature. There's not going to be remdesivir. There's not going to be some magical cocktail. You can look what's happening in Brazil. Somebody took that shot, their experimental vaccination. He died today. Gone. People having complications. People are shutting down their vaccination program because this is the risk you should take. There is no treatment for the SARS-CoV virus. And when we really talk about treatment, we have a thing that we use in my world called radical cure or clinical cure. Well, clinical cure is you take a steroid, you don't have a fever anymore. You take Motrin, you have no fever anymore. Hey, you have a respiratory problem and you can't breathe, we'll put you on a ventilator. That's what we call a clinical cure. We treat the symptoms. But a radical cure, there's no drug on this planet, as I speak right now, that can kill the virus in your body. Let me repeat that again. There is no drug or treatment on this planet, from remdesivir to malaria medication, that kills the virus. Period.
Okay. All right. Next question we have. I also heard one of the scientists say this is not a respiratory virus, but a vascular disease.
That's absolutely incorrect. This virus is the largest RNA virus in the planet. It's a multi-targeted virus that has the ability to be contracted through your eyeballs, your nose, your oropharyngeal area, your lungs, your gastrointestinal tract. We find the virus in your semen. We find the virus transmitting from mama to baby fetus. Babies are coming out COVID-19 positive. This virus attaches to your coronary arteries in your leg, can cause strokes, and also attaches to your vessels in your brain. So absolutely, this is a game-changing virus. And this is what we call, all the folks out there, there's a word that when I teach my class called trophism. TRPHOISM. Every virus in the planet has a bacterial infection, has trophism, which means that for that it causes an infection, that particular virus or bacteria has to attach to a certain cell. For example, I can give you rabies in a shampoo and you can wash your hair with rabies. You're not going to get it. I can give you HIV and we can make it into a suntan lotion and you rub it on your back. You're not going to get HIV. But if that rabies virus attaches to your gets in contact with your peripheral nerve, you're going to get rabies. If that HIV gets in contact with your blood cells, CD4 cells, you're going to get HIV. Well, this virus gets in contact with the ACE2 receptor, which is in your eyeballs, your nose, your throat, your tongue, your lungs, your coronary arteries, your semen, and your testicles, and the ovaries. This virus attaches to all these multiple. It's a multi-trophism virus.
Oh Lord, you said the testicles too.
Yes.
Wow, fellas. Okay, we'll go more into that. That's scary. So since you're talking about that, Dr. Roland, can you speak on the 7 F's that we spoke about earlier? I want the listeners to hear more about the 7 F's.
Well, I think the 7 F's are very important in the R, because what's happening now is that if we're going to make a game changer, the government's not going to change it. So we have to bring the information. And this is why I'm kind of glad I kind of started being a people's doctor and then work my way up to MSNBC instead of me being an MSBC and coming down. So my thing is give people the factual information that we use in infectious disease control in my world. If you folks out there take a pen and paper and write this down, because if you understand how diseases are transmitted, viruses, bacteria, then you can control your environment. If you control your environment, you control the virus. The 7 F's: feces, flies, finger, fomite, face, foot, food, flies are the 7 F's. And then we have 1 R, respiratory. That's the thing. If you understand this, ground roots level, at the people's level, understanding and controlling the 7 F's in infectious diseases in my world, and understanding the R, guys, you're not going to get the virus. It's impossible because you have situational awareness. How can guys like me work with Ebola? How can guys like me walk through the jungles of Amazon being bit by mosquitoes that says every God-named disease in the world, from, dengue to chikungunya, the Zika, malaria, and I don't get infected because I understand the principles of transmission of disease. And this is simple for folks.
Hey, all right, I am putting this in our chat box. Someone says fingers, foot. Yes, all of those things. I'm placing this in our chat.
People don't realize, and I've been talking about this, you can have the great biosafety security protocols. Hotel can have it. Steamship, airplane. But no matter what, folks, this virus is transmitted on the bottom of your shoes. So you can imagine somebody goes into the laboratory on an airplane, goes to McDonald's, takes a dump. They're asymptomatic or COVID-19 positive. They flush that toilet, that virus becomes aerolized. We call it ultra aerolized. The virus is only 0.1 micron, a micrometer. It is ultra aerolized. That virus gets into, you flush that toilet in your home because you folks don't put the lid down. There's a reason why there's a lid on toilets.
Yeah.
You can imagine in a public place. I was in the public health building today here in Raleigh. They don't have lids on their toilet. They flush that toilet. That fecal matter goes all over that place, on the floor, the air conditioner, the windows, the door handles, whatever the case. Person goes in there, walks in their shoes, and goes out into that bio lab. They're transmitting the virus itself. Or better yet, when you think about it, that virus lives in feces for 30 to 35 days.
Wow.
Game changer. Common sense. that we don't think about.
All right. I hope everyone got that. Did you get those sevens? We got feces, flies, fingers, formite, face, food, and respiratory.
No,
Am
we
I
got let me read again.
did
We
I
got
did I did I miss something?
formite, we have face,
Mm-hmm.
fingers, we
Mm-hmm.
have face, flies, and food. And we even find the SARS-CoV virus and y'all favorite food, some frozen chicken wings.
Thank God I don't eat meat. I'm still concerned on my vegetables though. It don't even matter.
Doesn't matter because guess what? It comes from organic. What y'all? I forgot what y'all bourgeois. Uh,
Oh, stop.
what y'all call yourself, Generation 95. Y'all
Oh,
have, but guess what? When they grow them vegetarian fruits and stuff and bean sprouts, they putting cow manure on that thing. That's why y'all always having these breakouts.
this is true. This is true. All right, we have a question from Facebook for Reverend Curry. Amiko asked, "Did you have any side effects from the Pneumovax 23?"
No, my arm was just so for a day, but it's fine.
Okay.
Where'd you get,
So I hope,
Dr. Carey,
Thank you.
Reverend Carey? Where'd you get your shot at? I want everybody to know.
I got it
You
at
got
my
that her
Kroger,
Kroger's. That is
my
the
local
beautiful thing
Kroger
about
store.
the Pneumovax 23 shot. You can go to your CVS pharmacy. You can go to your Walgreens. You don't have to have a prescription for it. Just go get it, just like the flu shot. And that
okay.
Pneumovax 23 is going to save your life more than the flu shot is because the Pneumo 23 is fact. It works against pneumonia. It kills people with flu and all
Yep.
SARS.
Okay. So even if you've never had, obviously,
Yep.
many people have never had this particular vaccine. So you've never had this vaccine, you've never had a flu vaccine, and you go and get this vaccine, you think it is still safe for that person to get it.
To me, my world, people with multi-drug resistant tuberculosis, I can go down the list.
Mhm.
People dying from respiratory disease. What people mostly die from is pneumonia,
Okay.
bacterial pneumonia, streptococcus pneumonia.
Mhm.
This vaccination is a game changer in
Okay.
my world in infectious
Okay.
disease. Recommend that to everybody all day. If you said, Dr. Rowland, are you going to get the SARS-CoV virus when they come out with it? I would tell you this is a time you socially disadvantaged Black folks. I'm going to be in the back of the bus with my grandchildren. I shot the first time. That's
I
just a fact.
understand.
I'm gonna let all
I understand.
pigs. I'm gonna let all you guinea pigs. They gonna be sandwiches. Put you guys on a bus, drive you down to the place to get your shot. Now you know that you can't get a test on the front end. You can't get into the system on the front end. But I promise you, y'all, they gonna give y'all a Subway sandwich and a peanut butter cookie. Put y'all on the bus. They're gonna inject the whole damn neighborhood.
Yeah.
Watch what I'm saying.
All right. So you heard it here, Pneumovax. Okay. So Dr. Rowland, J.L. Wright said that they refused to give him the shot.
Well,
I
he Well, this is 19. What year is it? We're in 1952. 19. What year is this?
this
1942.
is this is now 2020.
Man, you better go find you somebody and get you a shot. You better get away from that individual. I promise you, them healthcare providers, just like when they started, you couldn't
Come, lean in closer. I think your microphone is cutting out again.
you couldn't find any antibiotics because all the doctors were taking it home for their family members. So you
Wow.
go find stuff, doctor. Miss Curry got the shot at Kroger's. Yes or no, Miss Curry?
Exactly.
You want to say
Yes.
something, Dr. Jones? Because I know you're drinking. That's like your fifth glass of wine. You need to say something.
Absolutely. Yeah, absolutely. You know, I had the Pneumovax vaccine too, and I got it out from Walgreens. My husband
Okay.
and I, no side effects. Um, if you have insurance, usually insurance will pay for it. If you're over a
Mhm.
certain age, I mean, they sort of will give it to you routinely. Um, I think if you tell them that you're sort of high risk, like you got asthma or something,
Okay.
just like I'm just saying that your doctor suggests that you get it.
Okay.
I have not had anybody say that they've had any problems getting the Pneumovax 23 vaccine. I also took
Okay.
a look at their effectiveness rate. It is one of the highest. It has one of the highest effectiveness rates of all of the vaccines that I've seen. I mean,
Repeat that
just
again.
it's incredibly high.
Repeat that. Take your time.
Um,
Repeat that.
it
Everybody.
is the Pneumovax 23 vaccine has one of the highest effectiveness rates of vaccines that I've really ever seen. And for people, for older people, it's really high. Like they said, like between like 85 and 90%.
Okay.
Whereas,
Okay.
in a good year, the flu vaccine might be 25% effective, typically around 10% effective.
Okay.
So I'm
Okay.
just saying,
So
the doctor
yeah.
knows his stuff.
So
Dr.
what you
Lane
were
Rowland knows his
no,
stuff.
yeah. So not what we're not actually saying this, not really, kind of off the record, but maybe if you have an underlying issue, if you're high risk for some other or susceptible for other illnesses, if you're young, like I am, and a gentleman that shared this, maybe that's the reason why they said no. But maybe you should share with them that you are higher
I don't care
risk,
if
and
it's high.
that's the reason why you're trying to protect yourself.
Correct.
In the military. We get vaccinated for everything. And young folks, they vaccinate us everything in the military. If
Right.
somebody tells you no in this situation, in
Right.
this SARS-CoV, not endemic, folks, this is endemic. You better go find you a better doctor, or you better go down to Kroger's. I don't know what y'all.
Right.
I don't know if you come to the country. You better go down to Piggly Wiggly. Himself a shot.
See, this is an example of how we don't get premium care. When we want it, when we
Right.
ask for it, because this is premium care. This is gold standard
Okay.
care.
Okay. Well, you heard it, Jari. You probably should go to a couple other places and try to get that vaccine. All right. So, question from the street, Dr. Rowland. You ready for him?
Hey,
All
you
right.
guys knows out there, Queenie Love, that I'm an OG.
Yeah.
Let me
Yeah.
know
Yeah.
who he is. I'm an old gangster.
All right. So here we go. I got some questions for you. Oh, he said the sound quality was rough. I know. I'm trying to figure out where it's coming from. I do apologize. I don't know what it is, but again, I mean, this is live and it happens sometimes. So just bear with us. It will come back in. And I'm hoping that everyone can hear me clearly. I know whenever Dr. Rowland talks, I get a little bit of clicking, and I don't know what that's coming from. So just bear with us. We're going to get it working.
All them folks out there got them cheap Walmart phones. They need to upgrade.
He said that I did not. All right. So here we go. Question number 1. What did they... We're back at it again. You already answered this one. What did they treat our current leader with? And why do they treat him with that? And will this regimen be available to everyone? That was the question.
Ain't gonna be available to you. You know, that's just the way it is. I mean, he's in a different. Guess what? I'm gonna say it here. I've said it on Black News Channel. I've said it on MSPSN. He's still infectious.
Okay. All right. So y'all heard that. I hope this answered your question. The next question is, what precautions should I take if I need to travel?
Well, the most important thing is what we call situational awareness. I've traveled all over the country. You guys see my
yes.
And I'm not going to get infected because I wear my mask. I wash my hands. You know, if I have to use the bathroom, I make sure that I don't touch. I take a towel, open the door handle, dispose of that. I go in there and do my business, wash my hands, you know, with my antiseptic hand wash. Now open that door with a paper towel and I shut it. And I sit down and stuff. So I understand the awareness of the virus. I understand the 7 F's. I understand the respiratory. If you put this into your lives and teach your kids this, and your grandmothers and your family members, folks, you're going to have a very good outcome. And so flying is absolutely safe if you understand what you're doing.
Okay. All right. So I hope everyone heard that. And the next question was, what is the risk of infection when traveling by plane?
Well, the risk of traveling on a plane is probably a lot less than you going to Walmart and grabbing that cart where 500 people touch that
Oh, wow.
cart handle around. Are you in the store at Dittany Jungle or Kroger's or Albertsons or Smith's or whatever y'all eating at now? Them carts that y'all push got fecal matter, snots on them. They are absolutely nasty, and that is a transmission of diseases. What we
Wow.
call a formite, an inanimate object.
Okay, that's like the cell phone, correct? Can you tell us a little bit about these cell phones and
Yeah,
how they're
the out. Folks out there, listen to me very carefully. The virus can live on cell phones for 28 days. It can live on money for 28 days. It can live on your ATM card and ATM machines for 28 days. Lives in feces for 35 days. So you
wow.
need to understand the environment you're dealing with to protect yourself. And this virus is no joke. Period. End of story.
Yeah.
This
Yeah.
virus is what we call in the hood a true OG.
Wow. Um, d- so I saw you with your handy dandy micro sprayer. I have two, and they go with me everywhere. Can you show that once again to the on the screen, Doc?
I can show you right now is my wine. Won't you your part? Especially Dr. Jones, take over this part while I
Dr.
drink.
Jones has it.
Dr. Jones, explain to the people why you love this. It's very, very awesome. Go for it.
Okay, hmm, I love it because I can take it with me in my purse. I spray it on everything. Disinfects in less than 30 seconds. Um, I think that this is, first of all, it's a green, non-toxic, ProGuardian is a green, non-toxic, environmentally friendly,
Mhm.
proven effective, disinfected, proven effective against COVID. It's
Show people
critically important that we not use,
great
uh,
glasses. Use it. Show people how to use. Take your time.
that we not use products that are irritants to our lung systems, because SARS is already a lung irritant, so we don't want to add any lung irritants into our lives. So we should really stay away from Lysol, bleach, Clorox, and especially if you already have a respiratory issue, you really don't want to exacerbate that at all with some of these other chemical products. So it is the only green and non-toxic product that's on the market right now that is proven effective against COVID.
Can I say
So
something,
I
folks?
use it all the time.
Okay.
No, what I wanted, let me add one thing to that. I did a podcast
Come closer.
2 weeks ago with Icky Woods.
Mhm.
Icky Woods is famous for the Icky Woods Shuffle, Super Bowl,
Yes.
Yeah.
Bengals. I did a podcast with Icky
Wait,
Woods.
wait,
And
hold on, Doc. I want to make sure you're coming in clear. You're clicking still. I don't know what that is.
my stuff is good.
There you go.
Can you hear me now?
I can.
Okay, I did a podcast 2 weeks ago with Icky Woods, a famous running back that did the Icky Woods Shuffle for the Cincinnati Bengals. And I did an asthma and COVID-19. Icky Woods' son died at 16 years of age from asthma. Period.
Yeah.
He was
Mm-hmm.
and then to the SARS-CoV period. And what I tell people is that you cannot be having chlorine in your house. Use that. You cannot be using pesticide because Lysol, because these are what we call triggers, or we call OVC, organic vapor compound, cause an trigger with the SARS-CoV virus. You're going to be out of there. So you need to make sure you're using products or technology that does toxicity. And this is one thing SRS has brought to the market. But we know that the preponderance of kids have asthma are black. So I don't want to hear anymore. I want to use Icky Sun's life to save good people's life. And that's what's important. So listen to what Icky Wood with 16-year-old son.
Okay, so I know that it's coming in a little choppy, and I don't know what's happening with that. but the srsproducts.com link is up on the screen. So if you're interested in checking out the website, please take the website down because it'll be up probably at the end of our recording as well. But it's simply srsproducts.com. And I too use this product as well. All right, perfect. Let's move on. All right. So Emiko asked that hot food can kill COVID. Should we not eat cold salads and watermelon? Is that a fact?
Man, you ain't eating
What?
watermelon. You ain't black. I'm gonna eat me some watermelon. Summertime. I don't know. What must be some bourgeois question? Because I'm gonna continue to eat watermelon. I'm gonna continue to eat my salad. And I'm definitely eat collard greens and cornbread with a 7-Up.
Well, there you have it. Continue to eat your watermelon. Don't worry about it. Eat your salad as well. All right. Next question, Doc. They're laughing at you, you know. Next question. All right. During the winter months, how are doctors able to tell the difference between COVID-19 symptoms and flu symptoms?
Well, that's a very good question. Now, that is why we do not use clinical symptoms versus the use as fever. Because fever is asymptomatic. When I mean asymptomatic, you can have a tooth infection. Women can have their normal menstrual cycle and have a fever. You could have a fever from a different virus. The most important thing for distinguishing in this country on who has influenza is when you go to the doctor, you ask for influenza test for influenza A or B, and you will get the results within 5. If you get the results and they're negative for influenza A or B, then you need to start leaning towards start shortness of breath, fever for 5 days, have red eyes, maybe chronic diarrhea. Children have rashes on their bodies. Maybe they have body aches. That is one of the distinctions that you can make, but you rule it out. And initially, when you go to a doctor, you think you might have the flu, you definitely get the influenza test. It takes 5 minutes. And they will rule out you have influenza A or B. Then once they rule that out, then you go to a higher level. I need to rule out SARS-CoV virus.
Okay, I like that. So basically, go ahead and ask for that flu test.
All
And then
for the flu test. What did the doctor wrote? You always do what?
ask for the flu test.
Flu test.
Yes, so ask for that. So I hope that answers your question. Always ask for the flu test first. That's how you can figure out which one you may have. Okay, and then move up. All right. So the next question is: can the frequent use of alcohol-based hand rub solutions or surface disinfectants cause the SARS-CoV-2 virus and bacteria to develop resistance similar to antibiotic resistance?
Absolutely not. The only reason what I love about alcohol, what we use in our biological laboratories, we use in our surgical wounds, is that 70% alcohol, isopropyl alcohol, it kills 100% viruses, bacteria, and fungus. But folks, you have to understand that alcohol evaporates. And once that evaporation goes within a minute, you can still get reinfected again. But long-term use of using alcohol to disinfect things will cause more of your skin to crack, which can cause fissure, dry your skin out. Because it's an alcohol, it dries, it evaporates. That is the only thing that I can recommend is that you make sure if you're using alcohol, you better be making sure you're using some type of hand cream to make sure that your hands, your fingers are, still has the moisturization to have the skin content so your skin doesn't break, crack, and you can get a secondary bacterial colonization from it.
Okay, perfect. Thank you so much. The next question is: what is the difference between the novel coronavirus and the human coronavirus? There was a claim that mouthwash could break the membrane of the virus, and it was misleading to say the least. So, can you explain the difference between the two?
Okay, folks, everybody needs to get a piece of paper and write this down. We have really in our society, there's three types of groups or serotypes of coronavirus. We have an alpha coronavirus group, we have a beta coronavirus group, and we have a gamma coronavirus group. Well, folks, the common cold, which is the second leading cause of the common cold. I've had coronavirus. Everybody sitting or listening to me on this planet's had coronavirus, but you had the human coronavirus, alpha coronavirus, which is causes the common cold. These are called what we call, OC43, 229E, NL63, HUK1 are the four family members in the alpha coronavirus that we've all been exposed to. But this is a normal cold. This is when people start talking about my Clorox, my bleach kills coronavirus. Well, folks, they're talking about the human coronavirus that causes the common cold. They're not talking about the beta coronavirus, which is your SARS number 1, 2002, MERS 2012, and the SARS-CoV number 2, 2019-20. These are game-changing viruses in the coronavirus family that will kill you. And the gamma coronavirus is what we find in birds, pigs, animal coronavirus. So there's a big distinction between the human coronavirus, which is causing the common cold. I get it, you get it, everybody's exposed to it, and we get it every year, versus what we call the beta coronavirus, which is SARS-CoV-2, 2, which has a lethality that's unprecedented in our modern society. And when we use the word novel, folks, that's a bad word, because this virus is not novel. You go to Webster Dictionary and look up the word novel. Novel means kind of new. Well, this virus was discovered in 1960. This SARS-CoV virus was discovered in 1960 in 2 patients in England. The reason why is we had the technology. Electron microscopy was better. We could identify, we could see the virus under a microscope. But folks, this virus has been around for 50 million years, living in bats and pigs and animals, snakes and cows. Period. End of story.
Wow. All right. So thank you. This question is, I guess it would be more for Dr. Jones. This way, Dr. Rowland can sip on his wine for a moment.
Thank
But the question, the question is regarding domestic violence. This is Domestic Violence Awareness Month. And have you seen an uptick in domestic violence cases during the pandemic, or now we'll say endemic?
Yeah, well, this endemic has certainly caused a strain on relationships, because people are now together more. They are unable, couples are less able to perhaps get other sources of support or get their needs met in other ways. For example, if you had a friend that you traveled with or read books with or did things with, or just being able to blast off some steam with other folks besides your mate. So yes, we have seen a resurgence in domestic violence. If there were cracks and fissures in the relationship, this kind of catastrophic event, and this is considered a catastrophic event going through an endemic, certainly would illuminate and give and certainly show where those fissures and cracks are in the relationship, and and creates a certain kind of stress. It's like any other time a couple would have a stressor. Stressors either will strengthen a relationship or will pull them apart, and this is a major stressor going through a pandemic. So how we so the question becomes, how do we, what resources are we going to, because we're going to be in this for a while. I mean, we're talking about another year and a half at least. So what do we do as a society to help people go through this, and how do we help? What kinds of mental health resources are we going to be able to put in place for people, given that you can't go in to see somebody? It has to be through teletherapy or Zoom.
Please expand on children. I want you to talk about children and the right children not going to school. What's happening to the little minds in pandemic. Kids can't get their lunch. I want you to expound that on the people, so people can understand the psychology of people, the children.
Meaning, interpersonal violence between couples, but also what does this mean for children who might be abused at home, or in abusive situations in their home, where they're not able to at least have the relief of going to school, or the protection that going to school and being around other adults offers them. So we're also seeing a resurgence of domestic violence, or abuse towards children that's also happening. I don't know if you all heard about the story in Chicago where a 7-year-old child, was forced to engage in a sexual act, and she happened to be in school, and it was broadcast on over Zoom to the rest of her classmates, as this, of course, as this was happening. Now, of course,
Oh,
the person, yes, yes,
hmm.
yes. Um, now, of course, the perpetrator was, of course, arrested and all of that, but it just goes to show you that school can sometimes offer a relief, or some way of being a protective measure for children who maybe experience abuse at home, or just how do we or at least an opportunity for somebody to be checking in on the child, will sometimes make abusers be a little bit more wary about acting out their abuse. But because of the endemic, and because people are sheltering at home, and less open to outside eyes onto the situation, abuse can run rampant and give rise and increase. So
Mhm.
as a community, one of the things we need to be thinking about is how do we make sure that everybody stays connected to each other, even in the midst of this pandemic, in meaningful ways, whether
In
it's,
meaningful ways.
how do we stay connected in terms of talking to, reaching out to, making sure that all children have somebody else that they're, responding to. Like, for instance, my son, I let him have a phone. He's 12. But that was an important way for him to be able to communicate not only to his friends, but also to have a means of communication to other meaningful adults, that, of course, that we choose, but his godparents or other adults that will give him good advice. But he has a way to be able to connect with them.
Yeah.
This is,
Beautiful.
one of the reasons why it's important that kids go to school, and that we need to open up our society to some extent safely, and with the consultation of Dr. Lane Rowling and SRS, there are ways in which we can open up our society for meaningful activities safely. But we've got to, as you mentioned earlier, increase the health literacy, because
Yeah.
actually on the other side of the health literacy is the freedom to actually open up. It's just that we
Mhm.
got to get past the initial resistance to doing
Mhm.
these things. But actually, there's great freedom on the other side of that.
Right. Right. Thank you so much for sharing that. Dr. Rowland, we're going to come back to you. I'm going to mute you, Dr. Jones, because I think that's part of why we're getting the feedback. Okay. So Dr. Rowland, do you want to add something to that before I go on to the next question?
I think it's very important. That's why we came up with the cartoon character. With Dr. Jones helped me develop the format called Uncle Kooski. I developed an Uncle Kooski cartoon character that talks. He's in a comic book that teaches kids how to wash their hands, because I think sometimes we talk about the SARS-CoV endemic infection now, and we forget about talking about the most vulnerable people in our population, our generation, are our children. So we have to have that come to Jesus meeting and say, sit down with your children, teach them how to wash their hands, teach them how to use the bathroom properly, talk to them about why the society is different than what it was a year ago or six
Mhm.
months ago in their world. If they have the information, kids are pretty resilient. Kids are probably more resilient than us old folks, and especially as OG like me, because I'm a they will break. So kids are very resilient and stuff. So you have to have that type of conversation with children so they can understand the SARS-CoV viral infection. Understand this is not a pandemic anymore. This is an endemic
And
infection.
then,
This is going to be around for a while. Because
Right. Right.
Dr. Rowling, Uncle Kuski, Dr. Jones, Dr. Chocolate, Reverend K, we know what's happening.
Oh my goodness, Dr. Roland, he be rolling too. All right, so the next question is actually from my sister down in Savannah, Georgia. She said, during this pandemic, do you think that there will be a shortage of blood supply? And if so, how would the Red Cross go about having a blood drive?
I mean, there's already always that issue about blood
Yeah.
supply, blood itself, with the American Blood Association because people are afraid of catching HIV, people are afraid of
Mhm.
catching hepatitis through the blood supply, and now people have the right to be concerned if I go give blood or get blood, I might contract the SARS-CoV virus
Yeah. Oh.
over time. That we're going to have to see with science what the new protocols is. Usually,
Mhm.
when we take blood and we transfer it into people, we understand people's HIV status. We
Mhm.
understand hepatitis status. We understand if they have cytomegalovirus. We understand if they have leukemia trophic virus that can be transmitted. And we understand if they have syphilis. And maybe the new panel is going to be, have you been exposed to SARS-CoV virus?
Right, right. All right. So I have a side question that's not on this here. My daughter is in college and she was able to get a rapid COVID test when she went back to college. So do you think that here in America or even the globe will, ultimately end up in having like rapid COVID testing sites to go into clubs, to go into restaurants, to go into any type of social gatherings, concerts? I mean, is that where we're going, since I know that the college has the ability to give rapid COVID tests and results within 15 minutes?
We're just, this is an evening with Dr. Rowling,
Yeah,
drinking a glass of wine.
I'm having chocolate wine.
Just stuff. I was talking to Ireland. It had to be a different way. When I was talking to the American Bar Association, it had to be bourgeois,
Yeah,
intelligent. We're just talking right
just
now.
a chill spot here.
Hey, this keep it real. My
Yeah.
opinion, what's going to happen? Have any of you folks seen the movie Gattaca? I want everybody to look out there and watch the movie Gattaca with Ethan Hawke and Uma, his wife actress at that time.
All right, Gattaca. Okay.
This movie talks about in the future where you go down and you want to have a relationship, you want to find out, everybody's doing genetic profiles. If you're defective, they can predict if you're going to go colorblind in the future, die of diabetes or a heart attack at 52. Well, let me tell you what's going to happen, folks. Gattaca is coming, where you're going to function in this new society. Have you been tested for the SARS-CoV virus? Period. That's where we're going to technology, because we have to protect the society. And so these are the ethical questions that we are going to have. Miss Curry, she wants to go to Kroger's. Maybe she wants to go down to Piggly Wiggly and get her grits. Are we going to let her in the store to get her grits and collard greens? Or if she ain't taking a SARS-CoV virus test? And the only test, folks, that is accurate, and in the Gattaca, which means Gattaca is the DNA information, is
Mm-hmm.
PCR, which is 100% sensitive. That is where we're going. Not antigen antibody, because there's a lot of false positive, a lot of false. But we will be doing genetic profile in the future. Dr. Rowley, you want to get on this plane? Just do a PCR test. It takes me 5 minutes. Come back, beam. Dr. Chocolate, you good to get on that plane. Dr. Jones, beep, 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 beep. Security escort her out to the airport. Miss Curry, you want to get your collard greens? Can't get them today because you got a positive PCR on your collard greens, girls. You better go down to the jitney jungle. So this is where we're going.
Oh, a part of me, first of all, that kind of ekes me out, right? But then the other side is I can see that that's likely where we're going, because as humans, we want to socialize. We want to get out. We want to begin to live again. And this new normal is going to cause for us to have access to testing, and it has to be everywhere. And so first of all, I was thinking like, wow, this is going to be a big money making industry. That was the first thought, right? I was like, man, that would be great to be able to kind of have these rapid testing sites and set them up at all the clubs because we're going to the club, right? But you want to be safe, and so don't almost steal my ideal. And if you do steal it, you make sure you email me so I can be part of this now. But I literally was thinking about that, like at some point, because I know the rapid test, because we have that. I know that obviously you're gonna have to start setting that up in any venue where there's a mass amount of people, so you can go in, get the test before you go inside of the facility. I mean, that way you can actually. I want to dance again with someone. You know what I mean? Like,
dance with you, Queen. I want to dance with all the women out there.
Yeah,
What an OG can. I want to do the Cabbage Patch.
Yeah. Well, I'm thinking about backing it up, but I can't.
So Dr. Rowland is negative for the SARS-CoV virus, do PCR technology. He's allowed to do the cabbage.
Exactly. Yeah. And so, I think obviously that's where we're going. I mean, I'm here for it because I want to dance again. I mean, I don't know. I mean, if that may, I'm here for it.
That's the future, folks.
Yes. All right. So let me move on. I'm gonna go ahead and start wrapping this up. We got a few more questions. It's always so good to have you guys here and have this conversation. And I mean, I just love it. You're always welcome to come back anytime you want. So, how important and effective is contact tracing?
Well, that's very difficult because we're such it's funny when you talk about contact tracing. Isn't it amazing how Memorial Day, these folks in Ozark, Missouri, are talking about their constitutional rights, and them boys up in North Dakota, Sturgis motorcycle, talking about their constitutional rights, not the mask, where all of them fools are infected now.
Yeah,
I can't hear them.
Yeah.
Laugh the loudest.
Yes.
And so contact tracing is going out the window now. We can't have contact tracing really because the virus is already out the bag because you have this information. To have real good contact tracing, you have to have people that are honest, people that are the society, the system, the government. Hey, Dr. Rowland, you go to Denny's or you go to Applebee's and you have some chicken wings, and all of a sudden you get an infection and you get a fever, and I go home. Dr. Rowland, where'd you go last? Well, I was eating chicken wings with Miss Curry, and I was doing the Cabbage Patch dance with Dr. Jones.
Mm-hmm.
But I'm alive. It's my constitution not to know where I'm at. And that's the problem that we have because we have no faith in the government system.
Right. Wow. That's something to think about. All right, next question. Should children under the age of 5 take vitamin supplements such as zinc, elderberry, and vitamin C to help with their immune system?
Well, I don't know about elderberry, but I definitely know when I was a kid, I was taking Flintstone vitamin every day. That's my recommendation. All kids should take Flintstone's vitamin, multivitamin. They're going to be fine. And you start talking about elderberry and juju juice, New Orleans or Africa, talk about Flintstones. I'm with you.
Okay. All right. So, Dr. Jones, do you want to add? I have to mute you whenever he's talking because otherwise I get that clicking sound really loud.
Okay. Yeah, absolutely. I think the children should be taking a good multivitamin, a good zinc and vitamin D. Absolutely critical, important. Our children's food diets are not necessarily the best. So if we can give them supplementation that will give them all the essential vitamins that they need, all the essential amino acids and minerals that they need, along with some vitamin D, more vitamin D and zinc, that would be very protective. And I also think that that's good for adults as well, to be on a very good vitamin and supplement regimen.
Okay. And I guess with that, my thought is that since we're home a lot more now anyway, start really researching and figuring out healthier food options and stay away from, these fast food joints and this, and these processed foods. And, sometimes we want to take a supplement to fix the issue, but in truth, we truly could just eat better and let that, kind of start to build our systems up naturally. That's my thought. Dr. Lane, you can,
Yeah, well, Big Mama told me many years ago, baby, you got to have collard greens every day.
oh my God.
Baby,
You
you
don't need a fat back in them.
got to have your grits. I didn't say cream of wheat. I said grits.
Oh,
That stick to your bones. You got to have your catfish every Friday. You got to have cornbread. I didn't say hush puppies. I said cornbread.
oh Lord.
Miss, I said 7-Up. And I didn't say cocktail sauce. I said Tabasco sauce.
So no Texas tea.
Yeah,
I'm an,
and you're absolutely right, Queenie. Yeah, I'm not saying that supplements is a substitute for a good diet. No, a
right.
good food and nutrition plan. No,
Right.
but as you work towards, because it takes a while for people to develop better food habits. So as you work towards
Right.
developing better food habits, put the supplements in, keep the supplements in until you get your child where they need to be.
Yeah.
It's a journey for me and my son who's 12. To get him off
Can I?
the stuff that he's used to.
I
I
would
just
tell
refuse to buy
everybody
it
out
now,
there.
and we're still struggling.
Right. 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 Okay, hold on, Dr. Rowland. Go ahead.
I want to say the best supplement in the world. We're late now. To boost your immune system, boost your sugar up, is eat sweet potato pie. I didn't say pumpkin pie. I said sweet potato pie, and there is a difference.
Yeah. So let's talk about that immune system for a second. Um, I know that you're not a nutritionist, however, you have obviously some experience. And people, I've heard in several groups, we're kind of talking amongst ourselves about, like, a lot of doctors aren't talking about how we can boost our immune system, right? The lifestyle and the food. So, Dr. Rowland, just kind of off the cuff, what could you suggest for those of us that are interested in kind of strengthening our immune system, and how does that work? Like, the immune system is not obviously not a muscle, so how does that actually work?
I mean, the immune system is part of your system. You have B cells, T cells. I can talk about your adaptive immunity. I can talk about your humoral immunity, which could be your skin. It could be your pH of the vaginal area. These are basic immunology principles that we all have. The question is that it's not about augmenting or making your immune system strong, because we're all born, by the most part, with great immunity. The bottom line is that, do you have good nutrition? I.e., you might supplement every day in this pandemic, which is not a pandemic, endemic, by taking a multivitamin to give you that extra, a little bit of vitamins that you might need, because people don't realize you don't store a vitamin. You guys take a vitamin, you pee, you look at your urine, you
Right.
pee it out. You don't store vitamins, so the body's going to use what it uses and gets rid of it. And so my point is that your diet is what it is. I don't think you should be eating, ham hocks, every hour on an hour, 24 hours a day. I think
Right.
people have a balance. And whatever that balance is what you're balanced to. Because my food intake as an African American, I'm not an African American, I'm a Black American, is different than somebody eating tacos than Latin America. My food diet is different than somebody from Italy. I don't eat. I mean, I like fish and chips, but I don't like to eat all the rest of that stuff they be eating in England. So your diet should be curtailed to what makes you efficient, what makes you feel good, that you can function, but do not overindulge. I.e., I love peach cobbler. Guess what, folks? I'm gonna continue to eat peach cobbler. Forget y'all. Eat all the peach cobbler in one setting, but I will eat that peach cobbler over a week. That's a fact. So that's how you kind of base it. And plus, the most important thing is activity. Getting out walking, walking 3 or 4 miles, walking with your dog, walking with your girlfriend, whatever the case is, your friend, walking in that community to help your immunity. What we define as in the military is what we call fitness, is being able to go a distance and be able to perform later more distance. I.e., you're able to, and when you're in cardiovascular shape, it means that you can get up in the morning time at 8 in the morning, work all day until 5 o'clock. Then if you need to go another 5 hours, you can do that. This is
Right.
how I find fitness and stuff. So that's my take on that, because I'm going to continue to eat chicken wings. I like chicken wings.
Do you work out, Dr. Rowland?
Come on, what, do I look like I work out?
I mean, you do. But
Hair,
you know what?
my hair
You're
on, but you can tell I'm way
no, you did not.
in
No,
the
you did
winter.
not. But you're so super busy, right? So how do you find time to actually work out? Because I mean you're rolling around the globe, right? So how do you actually fit it into your
No,
schedule?
the serious part, I have a routine. When
Okay.
I have time, I mean, you can go to my Facebook. I walk 12 miles a day.
Yeah.
That's a fact. And people, I mean, I put down, Dr. Rowan walked 12 miles a day. But on
Yeah.
the average time, I walk 3.5 to 4 miles a day. I try to fit that in because that just also gives me mental psyche, and I
Right.
get to think about life and what I can
Mhm.
do to improve my life, improve who I am as a human being.
Yeah.
And if I made a mistake that day, how can I prove to be a better humanitarian? Then I also do Muay Thai, which is a certain martial arts that I do 3 times a week. But can I go 12 miles like I did a year ago? No, I don't want to do that.
Yeah.
I'm going to do Muay Thai and continue my walking. So the physical fitness that you design is for yourself. Some people like to ride a bike. Some people like to do Pilates. Some
Mm-hmm.
people like to do yoga. The most important thing is whatever exercise you do, the most important thing, folks, what we learned in the U.S. Army, period, and I'm a
Sure.
master trainer, is that it inspires you to be better.
Right, right. All right. I love that. So you guys heard it here first, second, and third. Make sure that you are getting in your physical fitness as well, because again, this is holistic, because we're all in this endemic and we're trying to stay safe, and mentally it's overwhelming, and when things become mentally overwhelming, physically it shows up. And so I'm glad that we're actually talking about this and that the viewers are listening, because we want to get through this alive and okay, and even better than we probably ever thought that we could be, by picking up these better and good habits, right?
But
Adding them into our lives.
I think you need to add too, isn't it wow that when we go through this pandemic, we really truly, and life it shows me adversity. You really understand people's true colors. You
Yeah.
find who your real friends are. You find who
Hmm.
people are. And that's
Yeah.
what I love about being a military guy is that when we go 12 miles, we jump out of the helicopters. We're humping through the jungles. And I look over to my buddy and I look into his eyes, I see his soul. He's going to go to distance. That makes me go to distance. But in this society, I found out is what people who truly really think about you.
Hmm.
Cares
That's a
just
fact.
about you.
That is a
Period.
fact. Yeah. That is a
Add,
fact.
talk to me, Queenie. Talk to
Okay.
me.
All right. Okay. Okay. So, what is your opinion on the way we are now treating those with severe symptoms that have contracted COVID?
Guys, I just got done doing a disability forms for an individual here. Hospital 10 days, ventilator. Folks, let me tell you, probably the biggest thing is not the actual getting the disease, the acute phase. It's always the rehabilitation after.
Mm.
It's the occupational therapy, the physical therapy. Do you have the mental issue? I've talked to people, and Dr. Jones has been on Zoom calls with me where people have COVID-19 disease, recover, and they want to commit suicide because they're not the same person they were before they had disease.
Oh my
Short
God.
muscle fatigue, chronic migraine headaches, body aches. And I told that individuals that the most important thing is that you have to have a positive attitude and think about your grandchildren, the blessings that you have. People get caught up in God, whatever the case is, but at the end of the day, you have to have faith in the unknown, the unseen, because that's what makes us human beings.
Mhm. I love that, Dr. Rowland. Dr. Rowland, that's all that we have for our questions. So I just want to give you space to talk to the listeners and the viewers. Share with them anything that you feel that would be beneficial or useful to them on this journey of trying to stay healthy during this second wave that's coming. And yeah, just share with the group anything that kind of comes to mind.
I think the most important thing is that that I look forward to continue to do the journey through this endemic infection. I want people to have confidence in what I tell you because I've been in the fields and stuff. Help me carry your cross. Let me say that again. This time around, help me carry your cross because I've carried people's crosses for the last 30 years in the jungles of Peru, around the world. And folks, I carried them crosses of babies that had died, and that cross is heavy. So this time around, listen to me, follow me. Follow me on social media, on my Instagram, Dr. Rolling, do that. Follow me on Facebook. When I'm doing all these different programs from MSNBC, etc., listen to what I'm saying because I've been there. I wear the same tennis shoes you do, and my feet are tired. I am tired, but I know that this is my moment in time to save people's lives at a bigger level than I've ever done, even though the little babies that I've operated on and babies that have died and kids that I've taken care of that had leukemia and go blind and they want to die and they eventually die. They're not going to go see Black Panther. They're not going to go to prom. They're not going to see high school. They're not going to have a girlfriend. Folks, appreciate the moment that you have and help Dr. Rowland carry your cross by listening to the information that I'm giving you. I am your uncle. I'm your brother. I am your dad. I am your role model. That is all I can say in reality. Because at the end of the day, folks, I don't care what you folks think. I'm going to eat me some grits every day.
So before we close out, I wrote a little piece here, and I just want to kind of talk about it or just share it with you. I do believe that Black medical professionals are vital to addressing COVID-19 and the health disparities. And so I appreciate you standing in that space for us. I know that you are a super healthcare professional and you're doing amazing work out here. And I think that more people should know what you're doing and and understand who you're doing it for. You have beautiful grandbabies that you often talk about. You got your babies, you got your family, and you have us, and we are your family as well. And I'm thankful for that. And I appreciate the fact that you believe that we all deserve access to proper medical care for prevention in this space with COVID-19 and more, all chronic diseases you have spoke about. So I'm appreciative of that. Minorities must have access to routine preventative health care, health screening, immunizations, and health education so that the incidence of health disparities and chronic disease will be eliminated. And I see that you're standing up for people like myself, and I cannot thank you enough. And I just want to take a moment to let you know that, I honor you today in what you're doing. And I really, really appreciate that. And I love the fact that you're being proactive in this space of health and wellness.
Well, I want to thank you and I thank Miss Curry, but let me revert to my southern voice before I
Sure.
get off. Because I'm a southern gentleman from Louisiana. I was born a country boy. I'm talking about thunderstorms in the afternoon. I'm talking French fries on a Friday with French fries and my grandmother chewing snuff.
Oh, yeah, 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 yeah. That's kind of how I grew up with my grandmother.
I left the reservation a long time ago, folks. I went south. Didn't
Yeah.
go. I'm back.
Yeah.
Help my
Yeah.
people out the best that I can go because I seen the Northern Star and it
Yeah.
brought me back home to make sure that I'm doing the best that I can do. Like we say in the Southern, we're gentlemen. Life is like a box of chocolate. Mama said, you never know what you're going to get. And I'm here for you folks. And I hope you guys continue to follow me. Queen Love, thank you very much for the platform. Miss Curry, I love your message every morning at 4 o'clock. I said, who in a damn is texting me at 4 o'clock 7 days a week? I
Oh, I
said,
love it.
My God, it is Miss Curry because you have conviction. I love your religious belief. Stay the way you are because at the end of the day, when you look in that mirror, you know who the hell you are. And in Dr. Boland's life, hell, my rearview mirror is broken. My car back, I can only look forward, like a Southern gentleman say. Nothing like the cicadas and thunderstorms to make you understand that you're from the South.
It's beautiful to know that you have someone that is watching over you, because that's what that spirit is. Like you said, she sends you that message at 4 a.m. There's nothing like having that person that's watching over you and believing in your journey. They're there for you. Oh, you're welcome. But yeah, they're there for you. So, Miss Curry, what part of the country are you in?
I'm in Louisville, Kentucky.
Ooh, you're in Kentucky. Okay,
Yeah.
okay. Well,
Thank
again,
you.
no, thank you so much, for joining us tonight. And of course, Dr. Rowland has some really good friends and good connections. And it's always a pleasure for him to bring another guest to the show. I always love it. And
Okay.
thank you for adding, and adding and sharing that you did have the vaccine. And I hope again that people can look at you and see themselves and say, you know what, let's go get that vaccine.
I had to
So,
advocate for
Why is this
myself.
important?
I
yeah,
had to advocate for myself to
You
get
know
that shot.
what?
yeah.
Yeah,
Thank
but
you.
why it's important to have people like Miss Curry are because there are people they
Yeah,
represent you.
yeah.
She uses Afrosheen. She uses Vaseline on her lips. She's
She might use a pressing comb, Doc. That might be a pressing comb right there.
I'm an OG. I don't know if they got blowout kits anymore.
Yeah.
But what I'm saying is that this is great, Queenie, that you're actually getting people from the community and have them give their testimony
Yeah.
on a platform so people can look at Reverend Corey and go, God, she's just like me.
Yes, exactly.
And this is beautiful and stuff, not coming from Dr. Chocolate, Dr. Southern guy, you know,
Yeah.
Dr. OG, real OG with a big OG. All you guys are what I call LG, little gangsters.
Well, once again, to the viewers, to all of you that tuned in, thank you so much for stopping by the podcast tonight. Please share the information out. Come back and listen to it again. I apologize again for some of the little bit of clicking that you heard. I finally figured out at the, like, I don't know, like almost at the end of it, what was
Dr.
going on.
That's Dr. Jones, that damn cheap Walmart phone.
And
Yeah,
she's gone, but she can hear you because she's still watching.
yeah, she's
But I'm thankful to Dr. Jones for stopping by. We did have some difficulties getting started, and so they showed up. The audio showed up later on. But listen, it's live. This is social media. This is what we go through. There is no faking the funk. This is what happens. But we made it through. We got the information out there. If you have any further questions, do not hesitate to come to my Facebook page, or even right here on YouTube, or even on IG. Leave a message, ask the questions. Dr. Rowland is accessible. He is not, he's not like with like full armed, security guards. He's not,
not like
no one's handling his schedule. He's the man that's able to be accessed.
not like 50 cents. I'm real. You have access.
Not like 50 Cent. No, exactly. So please, just, back it up, listen again. If there's other questions, something that did not come over clear to you, do not hesitate. We will get those answers to you. Dr. Rowland, once again, I'm always honored to be in your space. Thank you so much. I have to ask before we go, and I want to make sure everyone hears this. What do you have coming up? I know you're doing a million things, but is there anything that maybe we need to kind of be on the lookout for? We need to, I know, we could just follow you on YouTube, or I'm sorry, not on YouTube. We can follow you on Facebook or on IG, but is there anything you want to share with us so we can just kind of tune in? Any more MSNBC interviews?
To be honest with you, I mean, I can't keep up with it all, but I do know that the Denver Urban Spectrum with B. Harris is that I'm going to be writing a column every month on Ask Dr. Rowland called Rolling with Rowland.
Yes.
Questions that people can ask, and I will answer in their spectrum. This month, cover of the different spectrum, they have Diana Warwick. She's on the cover. And they have
Really?
Dr. Rowling. But I was on the cover in August.
Okay.
So Joyce Reed and Obama and all these bourgeois brothers are on that
Yeah.
cover. Dr.
Yeah.
Rose is on that cover too. So that's one of the big things. And I will keep people posted and stuff because I have the Black Women's Association. I'm doing a program with next week. I'm doing one with Colleen Ham out of LA. His radio broadcast. He had Rick Ross, the big time drug dealer that changed 3 weeks ago, which is huge. And I
Yeah.
hope to continue to do the things I do because I'm real. And like I said, you can pinch me
Yeah.
out. And guess what I'm gonna have tonight, guys?
What you gonna have?
I'm gonna have me. I don't hell no. I'm gonna have me some chicken wings.
You better make sure they cook those wings properly in that kitchen.
I'm in the kitchen back with them putting
Okay.
sauce in. But Clean Love, you are brilliant. Thank you very much. Miss Curry, I love your message, inspiration every morning, like clockwork from Kentucky. Queenie, you know you have access to me because I'm not some bourgeois individual. I'm the guy in the jungles walking the valleys of death. So you're all journey with me. And what's our next talk going to be? I say we should do it about a month because then the second wave is going to be kicking. So we've done Jack. We've done one.
So either we can do it
eggnog and rum.
Eggnog and rum. Y'all heard that. We're going to have eggnog and rum. So either we're going to do it in, I mean, you know, a month, of course, is the week of Thanksgiving. That's the 22nd. If you want to stick with the 22nd, I don't know what day that fall on right now. But we can definitely do it right before Thanksgiving or, Lord, right thereafter. I'm almost afraid to do it right thereafter.
I know I'm going to have some eggnog with some rum.
All right, so you guys heard it here first. Be on the lookout. I'll put the information out. We'll bring Dr. Rowland and friends back again in a month, and we are having eggnog and rum. Look, this is the bar. He decides what we're drinking, and we're gonna go with that. So eggnog and rum. I know, Miss Curry, Reverend Curry, you probably don't have eggnog and rum just lying around, but you can get something. You can bring something.
Let her fool you because she's from Kentucky. She's probably drinking moonshine.
Well, Reverend Curry, I wasn't gonna say that. I'm gonna let him say that.
Yeah, I have the wine. Okay.
So, you guys, I'll hang out for a second. I'm going to end this broadcast with my YouTube family and my Facebook family. Thanks again for dropping by Bar Talk the podcast. Thank you guys, and I'll see you in a month. Okay, with Dr. Rowland.